So anyway, I wonder when are we going to be... I'm just kidding. This is Dr. Dave here from Shore's Wellness Solutions. And of course, I'm with my beautiful wife.
Amy, nice to see you all. I think it's Saturday,
and
right?
Happy day, because we're not sure what day of the week it is. No, it is Saturday, and that's why we're coming to you live from our secret lair.
Well, no.
No.
We are not. We're not in our own office. Obviously, as you can tell, we are borrowing someone else's office because we are on the road today. And so we are...
On the road.
On the road.
That's right.
Right? Okay. So we're going to talk about blood pressure today and how to
why
lower...
we're on the road?
Why are we on the road?
Because I am now officially a full-fledged Michiganer.
Look at that. We're sharing now?
We're sharing. We're
Look
sharing
at that. Awesome.
So if you're not a Michiganer, that's okay. We still love you. And so visit us with Custom Nutrition Online.
Right.
All right.
So our topic today is taking control of your blood pressure. We're going to be talking about how to lower your blood pressure naturally without...
I know how to raise blood pressure.
He does know how to raise blood pressure.
So for me, I look at you, my blood pressure goes up. I'm like, whoa. And then for her, she looks at me and goes, ugh, my blood pressure's going up.
It's a little bit different, right?
No, just teasing.
Oh my goodness.
Maybe not.
Well, we're going to talk a little bit about blood pressure, what it is, and how to lower it.
Yeah, how to take care of it.
Mm-hmm.
And then throw in our little advice as far as opinions and studies and things like that so that you have more knowledge about it and hopefully can make a better educated decision about how you may take care of yourself or share with others so that they may take care of themselves naturally, of course.
All right, let's go.
All right.
What is blood pressure? Let's talk about that. What is blood pressure and why does it matter?
Oh, can I take this one?
Yeah, we'll let you start.
So blood pressure, real simple. It's the amount of pressure that your heart is putting into your vascular system, into your arteries. Not the veins, but the arteries. And so think about this. The heart, it's a pump, just boom, 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 always pumping. And as the heart is pumping, it's creating pressure. And so there's two parts of blood pressure. There's a high number and a low number. The high is your systolic, when the ventricles pump. The ventricles pump blood from the heart into the lungs and the other one into the body through the aorta and pulmonic artery in reverse. And then the low blood pressure is when the heart is at rest. It's really not. That's when the atrium pump. So blood comes into the atrium pump, that's your diastolic or your low blood pressure. And then the ventricles pump, which is your systolic or the first number, the higher pressure.
Right.
How'd I do? No, I'm just teasing. Go ahead.
All right. So we need to understand what is high blood pressure and what exactly does it mean, right?
That's a very good question. Go for it.
All right. Well, when the pressure required to circulate your blood is high, it places an abnormal amount of stress on your heart muscle and smaller arteries and reduces the amount of oxygen delivered to the smallest blood vessels in your body. Both of these consequences account for many of the secondary effects of hypertension. So some of the different effects that you can have is cough, diarrhea, constipation,
dizziness, lightheadedness.
Yeah. Feeling of nervousness, headaches, nausea, vomiting.
Erectile problems.
Yeah.
And I bring that up not to be funny. I bring that up because it's serious. Because we have a lot of our ED, erectile dysfunction, in this country because of the effects of lifestyle. And our medical community, our allopathic community, will give you drugs for that,
right,
but it doesn't fix it. And so you have this underlying condition of blood pressure issue, cardiovascular things that aren't being addressed, and it's being ignored just because someone took a drug and go, okay, I feel better. But you shouldn't, I can't say you can't, you shouldn't do that. You should really get to the underlying cause and then take care of that which is ailing you so that you can be healthy,
right,
naturally.
Yeah. So what are some common causes of high blood pressure?
Common causes. The biggest one, it has to be lifestyle.
Mm-hmm.
You know, with the lifestyle, particularly the SAD or standard American diet, that causes an increase of insulin and leptin resistance, which help to balance blood sugars. And when blood sugars can't be balanced appropriately and you have insulin resistance, that's going to lead to an increase in blood pressure.
Right. Insulin also helps your body to store magnesium, which helps relax your muscles. So that's very important as well. Yeah.
So with that, understand that what does the insulin do? The insulin helps to channel magnesium into the cells, helps to channel sugar into the cells to lower blood sugar, bring magnesium into the cells so that they can relax. And when you're insulin resistant, it can't help that process of bringing magnesium in. The muscle can't relax. It goes into what we call tetany, or muscle spasm. And what a heart attack is just a muscle spasm of a certain muscle of the heart.
One of the easiest ways to combat that is your diet. You know, having the right diet and cutting out the crap is going to make a big difference in how your blood pressure is and how everything is affected.
And of course, when we talk about the crap, you all know bread, pasta, cereal, biscuits, muffins, pancakes, waffles, donuts, bagels, cookies, cakes, candy, pizza, roti naan, empanadas, and whatever else is made from white trash, white flour, white sugar.
Right. So poor nutrition in childhood also is a big contributor for high blood pressure later in life. So it's really important to start at a young age and to teach your children the vegetables and all those things are really important to consume rather than all the sugar and all that.
Because vegetables have great fiber in them, which helps the body in many ways. We're not going to get into that discussion in another workshop. Vegetables have lots of magnesium and potassium in there, which is also great elements for the body when we're talking about blood pressure. And vegetables are cleansing to the body, have enzymes that the body needs. And in childhood, if you're not getting those basic building blocks, it may take years, decades, and sometimes you can't even recover from not having them during the first 20 years of your life, which brings you to us, where then we'll put you on a supplement or two that will help your body function better. A whole food supplement, not a supplement from Whole Foods, the store, but a supplement made from whole food so that we can replenish what the body's missing and substitute what your body can't do.
Right. Another contributing factor is air and sound pollution. Air pollution affects blood pressure by causing inflammation, and having inflammation in your body is going to raise your blood pressure. So we want to eliminate that as much as possible.
Yeah, and when we talk about inflammatory diseases, and we'll do that in another workshop coming up in the next few weeks, but when we talk about inflammation, I mean, we're talking about arthritis, we're talking about type 2 diabetes, obesity, but we're also talking about heart disease, we're talking about stroke, thrombosis, mine's blank. Too much inflammation. No, go ahead.
Well, we want to also address factors like avoid smoking, which is going to increase your blood pressure. That's a big one. If you're not sleeping well, getting enough sleep and getting really good quality sleep. So if you have a lot of noise because you're living in the city, you're hearing trains going off in the middle of the night, maybe wear earplugs so you can block that noise out so you can get a really good, nice, restful amount of sleep.
Yeah.
And increase your air quality, because that's important because it causes a lot of stress on the body.
You know, and when we talk about stress on the body, like living in cities, congestion, things like that, what stress does to the body is it stimulates your adrenal glands to release cortisol. Cortisol is a vasoconstrictor. It causes constriction of the blood vessels. And when the blood vessels are constricted, pressure rises. So for instance, you go to your allopathic provider and you're nervous about what they're going to find. Well, when you're nervous, that's stress, increased cortisol, causes vasoconstriction. Your blood pressure will be elevated slightly or sometimes even more. And that's what they call white coat syndrome. A lot of practitioners don't recognize that, or they don't want to because then they can't sell you a drug.
Right, then they can put you on medication.
But it's well documented, and we know that. We see that quite often. And what happens when you settle down? Pressure starts to go back down towards normal. It's important.
So what are some of the effects that high blood pressure has on the body? There are quite a few.
Yeah, there are some effects. So hypertension can lead to mental disorders.
It can cause a risk of stroke, which causes the blood vessels in your brain to rupture and clog more easily.
Right. You can keep going. You're on a roll. Yeah.
Hypertension may damage the smaller arteries as well, and reducing the amount of oxygen delivered and severely impacting the ability of organs to function.
Particularly the kidneys and the eyes.
Yeah.
Yeah, with high blood pressure, with hypertension, vision starts to change. Kidney function, you see the kidneys start to fail with that. You don't need new eyes. You don't need new kidneys. You need to address the underlying symptoms.
Right. Exactly. So you want to make sure, how do you know if you're at risk? That's the next thing.
Well, in the United States, 1 in 3 Americans are at risk with high blood pressure, and another 1 in 3, that makes up 2/3 of the population, have pre-hypertension. And that's not a good thing. That's not a good track record. So we have to really look at what's going on. You know, the systolic pressure, that's the higher number, the first beat of the heart, usually tells us a lot more information about how stiff the arteries are. You know, if we go back 50, 60 years ago, a good blood pressure, systolic number, was for males 100 plus your age, for women 90 plus your age. And as you age, you get to add 1 more point. So if you're a 70-year-old male, 170 or lower was considered good. For women, 160 or lower was considered good. But it's changed. We'll get into that in a little bit. But why was that considered good? Well, on average and commonly, you don't expect a 70-year-old male or female to have the same blood pressure as a 20-year-old male or female, because we've had 50 extra years of aging and the body becomes a little more brittle, not as pliable. And so you have to have some considerations there. Go ahead.
So another research showed that with hypertension, especially elevated systolic pressure can also raise your risk of dementia. So previous studies have already shown that stroke victims, even if it's a minor stroke, their increased risk of Alzheimer's is a lot higher. So you want to be careful with that. It's really important to make sure your blood pressure stays where it should be, and in a natural way without necessarily medications, because when you're taking the medications, now you're causing other issues and other organs to be affected as well.
Oh, we'll talk about that too. Not right now.
Okay.
So there's a lot of studies out there about blood pressure, or blood pressure, whatever. No, it's blood pressure. And one particular study found in older adults having an elevated average systolic pressure puts a greater risk for brain lesions and tangles associated with Alzheimer's disease. I have to talk about this. So back in 2013, there was a study done in Europe, and they studied 16,000 adults for a few years, and they found adults over 65, if their blood pressure was 140/90 or lower, they experienced good health and longevity. Then they looked at it and they said, wow, if we examine this, we find with adults over 65, if they have blood pressure of 150/90 or lower, and we leave them alone, blood pressure wise, they experience good health and longevity. But if we give them drugs to lower their pressure, what happens? They have their mortality rate goes up, and they experience ill health. Well, in 2014, in the United States, they released a study prematurely, which means stop it before we prove ourselves wrong. But they released a study that said, no, you need to have a blood pressure of 120/80 or lower, and we can give you up to 3 medications to get there.
So what happens if you're not taking the medication? Is your blood pressure high still?
Good question. I refer you back to males 100 plus your age, females 90 plus your age. And so we're in a country where we're so medically oriented. And if you look further into the detail of this, the average person in the United States over 65 takes 15 prescription medications per year on a regular basis.
Crazy. Well, diet is a really important role in reducing your blood pressure. And one of the biggest changes you can make is eliminating your sugar, especially processed fructose in your diet. You want to eliminate the sugar because that's going to help lower your blood pressure by doing so. It's very important.
Yeah, because the excess sugar makes you insulin resistant, which has a profound effect on blood pressure and the organs associated with that.
In 2010, there was a study that discovered that those who consumed 74 grams or more per day of fructose, which is the equivalent about 2.5 sugary drinks per day, had a 77% greater risk of having blood pressure levels of 160/100, which is a lot. And most people drink way more than 2.5 sugary drinks a day of soda or those energy drinks.
We call it pop in Michigan, don't we?
We do call it pop in Michigan. I was trying to help you out here.
Got it.
So anyway, most people drink that, or iced tea that's made with sugar or things like that. And you go to 7-Eleven, right? You get these huge, I think they're called big gulps or something.
Big gulps.
Maybe, I don't know. But most people drink more than that on a daily basis. And so they're increasing their risk of blood pressure, stroke, high blood pressure by 77%.
And when you say 2.5 drinks, that's not, I got a 32-ounce glass. It's based on an 8-ounce serving. So when you get a can of pop, a can of soda, that can of soda is usually 1.5 servings, because 8 ounces is the serving.
Right. So another dietary culprit is trans fat, which is responsible for hardening of the arteries. So you want to make sure you're avoiding trans fats, hydrogenated fats like margarine, vegetable oils, the buttery spreads that's not real butter.
Who comes
eat
up with
the
this
real
stuff?
butter. Don't eat these weird things because your body can't process it.
Trans fats, right? You know how trans fats are made?
How are they?
I haven't told you yet, have I? See, I'm holding out. So trans fats, they take old rancid oil. Oop, can't sell it anymore. It's old, it's rancid, it's bad. And not somebody, but they blast it with hydrogen for 24 hours. Sorry, I'm ahead of myself. They boil it at about 700 degrees for 24 hours with nickel to purify it. And then they strain it out. They get back 95% of the nickel. Where's the other 5%? Anyway, after boiling it for 24 hours, they then blast it with hydrogen for about 8 hours or so to thicken it up.
And that's what we're eating.
That's trans fats. And it was originally designed for food for turkeys, but the turkeys wouldn't eat it. Or do we? And anyway, they color it and flavor it and call it margarine, or I simply can't believe it's not butter, and things like that. And, right. And they put it in our diet. And I will say this, California, as nutty as they are out there, and yes, I mean that, and I have some good friends out there, Rob. So anyway, as nutty as they are, California has banned trans fats from their school lunchrooms.
Really?
But it really doesn't matter because they're not going to open up their schools anyway at this point.
Well, let's not get into
All
that right now. Let's keep going with what we need. We do need really good fats. So you really
Yes.
want to have animal-based omega-3 fats.
Mm-hmm.
That's something that's really good to be having. So you can get that in wild-caught salmon, anchovies. Those are a couple things, sardines, you know. And if you're not into eating all the fish, you can get a really good whole food supplement that will have the right fats in it for you.
Right. Like you can use a flaxseed oil, you can use a black currant seed oil. Those are really good as well. And the trans fats are good. Strike that. The omega
Not trans
not
fats.
trans
That is
fats.
not good.
No. The omega-3 fats are really good. They're heart friendly. You know, you hear a lot about keto diet, and it's so important that we get into fat burning, because when we're sugar burning is destroying our body. It's creating that insulin resistance. It's, you know, depleting our body of potassium and magnesium that are so important for that. And so it's so important to make sure that we are getting the proper diet. And I have to say this one. I love this one.
Okay.
Beets may help. And so beta food, as you know, is made from beets, which is one of the products we use. And so beta food, each tablet, and they're tiny. I don't have any examples here because not in our office, that's okay. Each tablet is equivalent to eating a beet about the size of my fist. And people say, well, I'll just eat a beet. I'll be like, yeah, but you need 6 a day. And
Most people don't eat 6 huge beets a day.
No, I don't. I can eat 1 a day, sometimes 2,
Right.
but I'll take the beta food. It's simpler. But what's it important for? It's important for methylation, which helps to detoxify our liver. So important for heart. You have to detoxify the liver in order to have a healthy heart and the rest of the body. But it also, besides the methylation process from it, it also has betaine, and betaine is very supportive of healing heart tissue and liver tissue, and so that's why beets are important.
Yeah. Wow.
And we also have vascular care complex on the herbal side, which helps to support down into the microcirculation. And so those two products together are fantastic. And the vascular care support also helps with people that have legs that are, I call it water heavy, where you're holding a lot of fluid in the legs, really helps to improve the vascularization there so that you can start reversing the process of that. I'll be quiet for a minute.
No, you're good.
Thanks.
Another thing that you really should incorporate every day is some exercise. Most people don't move much. They're sitting behind a desk, or now everybody's home working online, right? So we're sitting behind a desk on a computer all day long. It's really important to incorporate exercise. Get up, move around. You want to get that heart moving and flowing.
That's correct.
Want to add anything to that?
Nope.
All right. Well, potassium is also very important. You want to increase your potassium levels.
You know how you can tell if you're deficient in potassium?
I think I do, but I'm going to let you share that. Go right ahead.
Oh, I know you do. Yeah, we discussed this.
Uh-huh.
Yeah, so when you lay down at night and everything's quiet, and you got your head on the pillow and you're about to fall asleep, and all of a sudden in your ears you start hearing ba-boom, ba-boom, ba-boom.
You can hear your heart beating.
You hear your heart beating.
Yep.
And so when you're laying down at night and you hear your heart beating, guess what? You need potassium. Don't run out to the store and buy the chemical formulation of potassium. It just doesn't work, and it's toxic to the body. You need a good whole food source.
Yeah. So potassium is a naturally occurring mineral that our body uses as an electrolyte. diarrhea, vomiting, sweating, such as when you're using a sauna, which a sauna is good for you, but if you're over producing sweat, you're taking out a lot of the potassium that your body needs. So you want to make sure that you're adding potassium back into your diet.
Well, that's why they say limit your sauna use to, as you build up to, I think it's about 30-minute max. Why? Because you don't want to lose too much potassium too quick, because it puts a strain on your heart.
Right. The average reported intake of potassium from food is about half of the 4,700 milligrams recommended. Research demonstrates that the low levels of potassium may have a significant impact on blood pressure, especially as it relates to the amount of salt normally found in a Western diet.
So when we say salt in a Western diet, we're talking about sodium chloride, poison.
Right.
Does create heart disease and cardiovascular stuff. But when we talk salt and related to our office, we're talking about Himalayan salt. We're talking about Celtic sea salt, which has 84, 87 different minerals in there in good balance and will not give you heart disease, will not raise your blood pressure if it's real salt.
Right. So how does the gut play a role in blood pressure? Obviously, us eating all this crappy or not so good foods that a lot of people choose because it's convenient rather than your vegetables and things that are we know better for you.
We know the gut microbiome is so important in the function of the body, and you are what you eat. So if you're eating white trash, then you're feeding the pathogens in your digestive tract, and so what's going to happen? You're going to be more unhealthy, poor neurotransmitter. You're going to be more in a sugar burn. You're more likely to bring out the negative effect of your gene pool. Okay, it's epigenetics. We all have the genes we have, and they can be good or bad. We all have good and bad genes, but it depends. What are we trying to stimulate? I won't get into my movie reference on that. Okay, but then if we eat good, healthy foods, we're stimulating our genes, the gene pool in our body, to be healthier and to promote health.
Yeah, your intestinal bacteria is part of your immune system as well, and researchers have discovered that microbes of all kinds play an instrumental roles in countless areas of your health. So you want to make sure nutrition plays a good role in the function of your gut, which leads to a lower blood pressure. A lot of times it's very important to add probiotics because if you don't have that good bacteria in your gut, you're not going to function as well.
And the best way to take probiotics is a probiotic, first off, that has a prebiotic in there, the food that it needs to survive, and on an empty stomach. Now,
not all probiotics are the same either.
No, they're not.
So you have to be very careful on what you're putting into your body.
And if you're not used to taking a probiotic, start taking it with meal, because if you take it on an empty stomach, you might experience some digestive upset because your body's not used to it. And as it's trying to come into that delicate balance of where it needs to be, that might not be the best. So start with it always on an empty stomach, or start with it with food and then get to an empty stomach.
Right. So you can also get some probiotics in the form of yogurt, kefir. There's different supplements like we talked about before that's going to help with that as well. But you want to make sure that you're incorporating that into your daily regimen so you have the most beneficial results. Does anyone out here take a probiotic besides us? If you do, put it in the comments. Let us know if you're taking probiotics, or if you have any questions about what probiotic to be taking, let us know. We'll be happy to help you out with that.
Can I get back to potassium for a second?
Sure.
So I had this patient come into the office. This is about 5 years ago, Nina. Lovely woman. Oh my gosh, I loved her. And so she comes in, and she's older. She's 72, 73 years old. And she comes in one day, and she's not feeling right. So we take her blood pressure, okay? I almost died. Her blood pressure was, get this straight, 214 over 110.
Not good.
Now that's high.
That is high.
And I said to her, Nina, what's your doctor's number? I'm sending you to your doctor. I'm not going to my doctor. Nina, you have to go to your doctor. I'm not going to my doctor. I said, well, I'm not sending you home. I said, here, chew this. The supplements that we have, because they're food, so you can just chew them. Right. I'm not chewing that. Then you're going to your doctor's. Fine, I'll chew them. So I gave her 4 tablets of a supplement, organically bound minerals, by standard process. She chewed them, took her blood pressure 10 minutes later, and it was down to 162 over 95. Now, still high, but not 214 over 112 or whatever. And she looked at me, and because when she came in, she goes, I'm not taking any more supplements. So I had her chew these, and then when I took her blood pressure again, she's like, I want to take those. So she took them. She took 8 a day for about 3 months straight. We took her blood pressure each week when she came in, or every other week. And her blood pressure just right down, stayed in the normal range. And she stayed on 4 organically bound minerals for a couple of years to help replenish the potassium that her body was missing. That's one thing that will help with blood pressure.
Right.
And for her, it was potassium.
Exactly. And everyone's different. So that's why it's important to get checked to see what it is that your body needs so you can feed it the right nutrition that it needs specifically for you. Because not everyone eats the same foods. Not everyone does the same amount of exercise. So another thing that's important to add into your diet as well as fermented foods. That's another aspect of helping to lower your blood pressure.
Beer and wine are fermented. I'm just teasing. Well, no, I'm not teasing. They are, but that's not what we're talking about. We're talking more like sauerkraut.
Yeah. There's a difference
beets.
between traditionally fermented foods and the processed fermented foods that you're getting in the store. So you want to make sure that you're using the right fermented foods as well. And a general guideline is eating about a 1/4 cup or a 1/2 cup, 2 to 4 ounces of fermented vegetables or other cultured foods. So you want raw yogurt, kefir with 1 to 3 meals every day, which is going to help to lower your blood pressure.
Now, obviously, if you're lactose intolerant, and that's another workshop, another time. If you're lactose intolerant, careful of the kefir and of the yogurt.
Right. So you want to make sure that you're eating the right things and you're doing that on a daily basis to help to lower your blood pressure.
And something to understand with probiotics. Most probiotics that you buy are not antibiotic resistant. They're not. So if you're on an antibiotic, you say, oh, well, I'm taking a probiotic. The antibiotic is wiping them right out. So that's what I love about Standard's process. Their probiotics are antibiotic resistant because of what they're made from and how they have the digestive tract work. It's not just, consuming, healthy, beneficial microorganisms. It's about how they're processed to protect them and help your body.
And when you look at the Mediterranean region, they have rich olives, olive oil, fresh vegetables, fruits, seafood. They don't eat a whole lot of red meat. And those people are known to be some of the most healthy people on the planet.
And longevity.
And they live a lot longer, but they're not incorporating the sugar, which is one of the #1 culprits for increasing your blood pressure and having your health decreased.
Right. And be careful of the PAM, or the Pan-Asian modified Mediterranean diet. We see that a lot, and it's not quite as heart healthy at times, because they might minimize some of the synergistic fats, and we see that a lot. We have these for years, and I won't go into the history of it today, but for years we've been promoted a low-fat diet. Well, if the heart feeds on fat, and you have a low-fat diet, you're putting a tremendous strain on your cardiovascular system.
Well, another misconception too is to cut out all the sodium and have a low sodium diet. And so you touched base a little bit earlier about that. There's a difference between the salt that everyone uses, the table salt, right? It has a lot of chemicals in it, and your body can't process things the way that it's supposed to when you're using that salt. So when they're telling you to cut out the salt, you really don't want to cut out the salt. You want to use good salt, the Himalayan salt and things like that. Actually is going to help to lower your blood pressure if you're using a good salt.
And it's important because our adrenal glands, we talked about that, right? The cortisol effect and vasoconstriction. When the adrenal glands are stressed, that causes an increase in blood pressure because the adrenals can't control themselves well. So they keep pumping out extra cortisol and blood pressure keeps inching up. Well, the adrenal glands need salt, the real salt. Okay, so the adrenal glands need salt. And so it's so important. So, I like to do human experiments with my body before I do it on patients. So I did low salt for a bit and, made my blood pressure go up and stuff. But to get it back, I took Himalayan and sea salt and I made it snow on my food for about 3 months. Blood pressure did what? Went back down. Health of the body went up. Lost the swelling around the ankles from, and it wasn't like, big swelling, but you can see the indentation from plastic lining. So really made a big difference in getting me back to health.
Yeah. So we're going to talk another way that you can help reduce your blood pressure.
Can I introduce this? So I'm going to turn most of this section over to my lovely wife because in this conversation right now, she is the expert in this. And it has to do with essential oils and real essential oils. not things that say essential oil and they're fragrance with chemicals or laden with stuff that says you can't consume them because they have fillers or toxins in them. Real 100% pure essential oils. Take it away, babe.
All right. So an essential oil is basically the plant that's highly concentrated. It's often produced through distillation, and some of it is produced from the entire plant, and some of it just is specific parts of the plant, like the leaves, the bark, and the roots. Okay, so you want to make sure that the products that you're using, if you're using an essential oil, whether it's topically or internally, you're getting an oil that is completely pure. We do use doTERRA essential oils. We've done lots of outside tests besides of what the studies that they've done, and we're very, very confident in their products that they're 100% pure. And you can always check. I don't have any with me because we're still traveling, but on every bottle there's a batch number that you can check where it was sourced, the purity of it, and track all of that to make sure it's really good. But essential oils have been known to help lower blood pressure. And we're going to talk a little bit about some of the best essential oils to use to help lower your blood pressure. All right.
So when you're told not to consume something because it might have a negative effect with the drug you're on, like you can't have grapefruit or you can't have this or you can't have that with this drug, wouldn't you want to question, why the heck would I want to take that drug?
That's true.
Okay, go for it. Bergamot.
Yeah, so
I like bergamot.
Yeah, bergamot is one of the great essential oils that's going to help to lower your blood pressure. It helps to reduce blood pressure, it helps to reduce anxiety, and it helps to improve your mood. So bergamot is a great one to incorporate into your daily use for lowering blood pressure. Clary sage is another great one that helps to reduce the systolic and the diastolic measurements. It reduces your respiratory rate and decreases symptoms of stress and depression. Go ahead.
So think about this. Somebody has elevated blood pressure. They're feeling a little distressed, right? A little tightness in the tension in the chest, right? Because that's what happens when blood pressure goes up. We have all these physiological changes. And so clary sage, take a drop or two, put it on your body, inhale it, and all of a sudden the body starts to relax out.
Yeah, now, you got about 30 seconds. It gets into your bloodstream, and it's going to reduce all those tension, stress, and all things like that.
Crazy.
Rose essential oil. Now, that's one of your most expensive oils, so you use a very little bit, but the scent of rose oil is very calming. It helps to relax the brain, so you're not feeling all the craziness and everything else.
Did you know it takes 44,000 rosebuds to make 1 5-milliliter bottle of rose oil?
Which is why it's so expensive. So you want to save up for the rose oil if you're using that. Frankincense is a great product that helps to reduce stress and promote a peace of mind. Frankincense also helps with brain function, which is really good.
She makes me take it every day.
We need to help them thinking clearly, right?
Uh-huh.
It's very good. We just put a drop or two under your tongue every day. I like to use it internally. It has not the best flavor, but it doesn't really matter. The health benefits far outweigh that. So you can put it... Flavor. I know you do. You can put it in a veggie cap if you're not liking the flavor or the taste of it, but it's just quick. Drop a couple drops under your tongue every day, and it helps with so many things, cardiovascular, brain function, and everything else. Rosemary also is a great essential oil to use. It retards the hardening of the arteries. So, which that raises your blood pressure. So by taking rosemary every day, it's going to help reduce your blood pressure. It's
one of the things, and there's a bunch in our arsenal, that help to reverse the arteriosclerosis, hardening of the arteries, so that you can bring pressure down. And it's not quick, it's a slow process, but it works.
Yeah, so ylang ylang is another one. It comes from a small tree known for use in trauma and shock to reduce breathing and heart rate. So it's an antidepressive, it relieves anxiety, and it also helps to control your blood pressure. It's a great one. It also balances hormones, which is a side note. I know we're not talking about that, but ylang ylang has a lot of benefits.
It's good for the romantic side, too.
Yeah?
Yeah, it is.
Lavender is the last one that we're going to talk about today. It helps to aid in neurological disorders. It reduces anxiety, and it acts as a mood stabilizer. and kind of like a sedative. So it helps it's really good in helping to reduce your blood pressure.
I love lavender because it has so many more effects than that. And I've used it and watched it in action over the last several years. So really a fantastic oil.
Mm-hmm. It is. Mm-hmm. So did we talk about exercise?
A little bit. You want to include exercise.
Mm-hmm.
So with exercise, listen, get up off the couch, okay? And you don't have to get up for hours, but you really should exercise 2 to 3 days a week cardiovascular wise for no less than 20 minutes. Half hour. Get out there and move, walk, get the heart rate up.
Even if you need to split it up.
Yeah.
Do 10 minutes here, 10 minutes.
Exercise
10 minutes,
is accumulative. Something. But you want to do cardiovascular exercise 2, maybe 3 days a week. But just as important, and probably more importantly, is resistive activity. Because the resistive exercise will crank the heart rate up and bring it down, up and down, and up and down, which is good for the variability of it. But that also helps the body produce adiponectin, which is a hormone that your muscles produce by using your body fat, which helps you burn more body fat. And so it's a wonderful way to help really improve, the physique of the body. You say, oh, why do you say that? Well, I say that because we're here to promote health, and that's important. And so get up and move. It's heart friendly. Slowly over time, you'll start to change how your body feels. And so you won't be sitting on the couch and becoming more couch potato and stuck on the couch because you broke down. You actually work on reversing the body and getting healthy again. That's what we're about, helping people get healthy.
And research shows that inactive individuals have a 30 to 50% greater risk for high blood pressure. So it's very important to move. Even if you can't do anything strenuous, start somewhere. Because doing one thing today is better than doing nothing at all.
That's right.
Right? So you want to make sure that you're at least moving that body every day because you're going to have a significantly decreased risk of high blood pressure.
That's right.
Right? All right.
So before we end, I want to talk a little bit more about supplements.
Okay.
Okay. So other signs of heart issues, like bradycardia, which is a slow heart rate, tachycardia, which is rapid. You hear a lot about AFib these days. And there's a lot of drugs that are being invented and developed to help do this. Well, what the drug does is it stimulates the nervous system to produce a false effect in the body, thinking the body to slow the heart rate, increase the heart rate, stimulate the atrium so you get out of fibrillation. But it's so much easier than that. It's diet that has brought most of that down. I won't say all, but most, over 90% of that, it's diet that has brought that on. And so when you get somebody in an AFib, we can use an essential fat, one of them that we use to give to people that helps bring calcium into the tissue and get rid of the AFib. We can use things that'll strengthen the nerves. And this is all whole food supplements, like a Cat B, which is, well, I won't get into it what it is, but what it does is it strengthens the nerves so you get better impulsing around the heart so the heart can beat better. Like the one herb that we use. I'm not going to say it because I don't want people going out and getting stuff that's of inferior quality. But an herb that we use that really helps with regulating the rhythm of the heart, but naturally. It's not pushing it, artificially like a drug would do. It's doing it naturally, allowing the body to get back into normal rhythm. And there's so many more things that we have. Like we have a supplement that helps bring oxygen to the heart. And I have witnessed this where there was a gentleman next door to my office, this is about 10 years ago, sitting on his couch having a heart attack. And I look out the window and there's the police with the blue box walking there. And I run next door and there he is clutching his chest with, so I go back to the office, I grab the supplement, it's an essential fat supplement. I bring it over to him. I gave him a handful, 15 or 20. He pulls the mask off and chews this, not knowing what I'm giving him, chews it. And you watch over the course of the next 10 minutes, just this body, just peace come over it and the tension come out. And he was out of the distress. And, I run into his wife a week later and she says, what did you give him? And I'm like, why? Because I haven't seen him, right? She said, well, he had a quadruple bypass. And the surgeon said, there's no way he should have survived that heart attack. None. So whatever you gave him worked. And it did. What I gave him was something that causes an immediate uptake of oxygen into muscle tissue, particularly the heart. And so when we know and understand how supplements work and how they feed the body, there's so much we can do to help people, and you don't have to take toxins to change the way your body's working.
Exactly. And a few more drug-free methods you can do, because we don't recommend, unless absolutely necessary in a very short amount of time, the medications, is, making sure your lifestyle changes. You're reducing the sugar. You're stopping smoking. It's a big one.
Mhm.
It's a big thing that increases your blood pressure and risk of heart disease and stroke and all those things. So it's important to quit smoking. Another thing is you want to address your potassium to sodium ratio. That's something
huge.
very big. That's going to make a difference. You want to also
Potassium to sodium ratio. I'm sorry, I got to bug it. I got to step in. So I see on blood tests all the time that come back, and here's your potassium level, here's your sodium level within normal range, and these medical providers that are ordering these blood tests are telling patients everything's good. But I look at the ratio and I go, whoa, how can your heart be beating the way it is? No wonder they want you to go for an EKG and all that stuff, because the ratio is out of balance, and if it's out of balance, it can't work right. And when we get your minerals back in balance, all of a sudden your heart works again and the EKGs come back normal.
Right. Another big important factor is reducing your stress level. Addressing stress, which is going to increase your blood pressure.
All right, cortisol effect, vasoconstriction. Remember when we were kids? Maybe not you. So when we were kids, all right, you got a coffee stir and a straw and a Slurpee, right? And you'd go to the coffee stir and you'd suck really hard, to get that Slurpee up, and you're sucking really hard. Then you go to the regular straw, and as you go to suck up that Slurpee, it'd be like you drown yourself in Slurpee. Think of that with cortisol, right? You go from the straw to the coffee stir. That's what cortisol does, and that's why blood pressure goes up with cortisol and stress.
I can say I'd never done that. I never even would have thought to be sucking things out of a big straw or a little straw. That must be a boy thing.
Human experiments. Human experiments. Just as a kid. It was awesome.
So you need to suppress your negative emotions such as fear, anger, sadness. It can severely limit your ability to cope with everyday stresses in life. And right now is a really trying time for a lot of people, and the stress levels are very, very high. But it's really important to find natural ways to reduce your stress. You don't want to smoke more because it's going to increase your heart. It's going to increase your blood pressure and things like that. But you want to find a way to reduce your stress. Meditate, yoga. One popular method is emotional freedom technique as well. It's easy to learn. It's easy to use the techniques for reducing negative emotions, and it combines visualization with calm, relaxed breathing, so you can help reprogram all these emotional patterns that you have, so you can actually reduce your stress and relax. Yeah. It's very important.
EFT is a wonderful tool to use, because what it does is it helps to reset neurological patterns, and you can learn how to do it yourself. There's some great EFT practitioners. I know one in particular that I would be more than happy to refer you to, and she can work with you in person or distance, because she can talk with you through FaceTime, there we go, get it right, through FaceTime or on the phone, and really helps. I mean, she's amazing at what she's done with some of our patients with EFT.
So I know you might be feeling a little overwhelmed. We've talked about a lot of things today, but please know that we're here to help you. If you have any questions, or you just want to come in and get checked to see how we can help you put a program together that's specifically tailored for you, so you can reduce your blood pressure and live a very long, healthy, vibrant life without really feeling crappy, because it causes so many issues by not lowering your blood pressure.
It does. It does.
Well, I think that's it.
Thanks.
Anything else?
Yeah, how about we give everybody a call to action?
What's that?
I was hoping you come up with it. No, I'm kidding. I'm kidding. So, 2 calls to action. One is, share this video with somebody you know as soon as we finish up, because you don't know. It may save their life.
Right.
So share it with a loved one or two. That's the first call to action I have. And the second one is, if there's somebody you know or yourself that would like more information, take a moment and contact us.
Yeah, we'd be happy to have a consultation with you to see what's going on with you specifically, how we can help you, and make sure we're getting you on the right protocol that's going to be most beneficial for you and your needs. So we're really glad that you joined us today. Like I said, please make sure you're sharing this video with others, because others really need to know how they can get well and how they can reduce their blood pressure. It's not that hard to do. You just have to have an understanding of what it is that you need to do, and get on the right nutritional program that's going to help to reduce that.
That's right.
So that's it.
All right. Shores Wellness Solutions, the Natural Health and Wellness Center. I'm Dr. Dave.
And I'm Amy.
And we want to be your inspiration
for healthy living. Bye, guys.
Bye.